Hello everyone, I just want to briefly speak about and show you a video on the HRR pseudo-isochromatic plate test, which all of you have. So the HRR pseudo-isochromatic plate test is a quick screening device and it's a very useful test in a clinical situation. So most of you have it in a trial case. It costs about $300 to $400 and it's a pretty handy one because it can detect a red-green deficiency as well as blue-yellow deficiency, which is Tritan defect. So it's a pretty useful test. So before you start the test, you typically want the correct lighting condition. If possible, use the right recommended standard illuminancy. And then you have to give clear instruction to the patient. You have to really tell the patient that you're going to see some colored symbols, and the patient has to point out to the colored symbols. They have to name them and point out where it is, and they should not touch the HRR plate. The other most important thing is you are usually expecting a rapid response as you flip through the booklet or the pseudo-isochromatic plate. Typically you give 5 seconds for a plate. If the patient takes longer, that means they have some issues or some kind of deficiency, or pigmentation differences too can delay responses. So typically 5 seconds, 5 to 10 seconds is more than enough for a page. Don't give them too much time for each particular plate. The other important thing before you begin is make sure they are wearing their habitual correction, because this is done at near comfortably between 40 and 50 centimeters. So generally it's recommended to do it under standard illuminancy. If you don't have it, it's okay as long as the clinical room illumination is about 300 lux. If you don't have 300 lux, then it's not ideal to perform this test. Coming to the test itself, this is the typical scorecard. If you see on the left side, there are some, this is the scorecard of this. On the left side, there are plates 1 to 10. It starts only from 5 to 10. The reason being the first 4 plates are called demonstration plates. So you familiarize the patient first with the demonstration plate. So in the demonstration plate, of the 4 plates, the first 3 plates has either a circle or a cross or a circle, triangle. You have them in a combination. The 4th plate is actually quite an empty plate. So what that means is you tell the patient not only are you going to see circles or triangles, at the beginning you say some plates may not actually have anything, because this prepares both a normal person with color vision as well as a defective color vision person to expect that some plates won't have anything. So you're mentally preparing them for all this. So the 4 plates are demonstration plates. They're not actually scored. That's why it starts from 5, 6, 7, 8, 9 and 10. So these are called screening plates. The plate 5 to 10 are called screening plates, and only if someone makes a mistake here, you'd go to the subsequent plates between 11 and 24. For example, if someone makes a mistake in 5 and 6, that means they have a Tritan or blue-yellow defect, you can directly jump to the last 4 plates, 21, 22, 23, 24, provided they get all these plates right. So the only plates you're really going to show the patient or a typical patient is plate 1 to 4, which is a demonstration plate, and 4 to 10. You stop at 10. If they get everything right, or if they make just one mistake, it's acceptable. You stop the test. That's the end of the test, and they're classified as color normal. If they misread, or if they miss some of these plates, either the red-green zone or a blue-yellow zone, then you would administer the subsequent plates between 11 and 20. These are called diagnostic plates. So here, typically on the left side, that is the first few plates, if someone has a red-green deficiency, they're going to miss these plates. So if they get the plates correct, you put a check mark. That's a typical indication. On the right side, you don't offer, you don't show these plates to the normal color vision person. You would only show this if they fail the left side, and these would actually classify into Protan and Deutan, also mild, moderate, and severe based on the severity. So essentially, these plates are designed so that a Protan would be able to see certain symbols, and Deutans will be able to see certain symbols. So for example, Protans would be able to see all these symbols, Deutans will be able to see all the symbols. So you total them up, whichever error is more is the classification of the defect. Sometimes I've seen both Protans and Deutans making equal mistakes. Sometimes Protans have made more mistakes than Deutan. Sometimes Deutan's more mistakes than Protan. If they make equal mistake, it's unclassified. You generally have to repeat the test couple more times to make sure that it is not just a coincidental error. In occasional cases, I've also come across where a Protan is classified as Deutan and Deutan is classified as Protan. Unfortunately, HRR is not a gold standard. It's more of a screening test. So sometimes you can have misdiagnosis like that. Certainly, you're only going to tell the patient you have a red-green defect. You're not going to tell them Protan or Deutan. You can tell if you're confident in your finding if the test clearly shows it. But many times, red-green deficiency is more than enough because this is not the gold standard. The Nagel anomaliscope is considered as the gold standard for color vision test. So as I mentioned, you have demonstration plate, which are 4, which are not scored. Then you have the screening plates, which are 6. The first 2 are for blue-yellow defect or the Tritan defect. The next 4 are red-green defect. These are really harder to see. So for someone with the deficiency, they would actually fail here. And only if they fail here, if they make 0 errors or if they make 1 error, they are passed. If they make more than that, then you would go to the right side. The main advantage of HRR compared to HRR test is they have Tritan plates, Tritan skinning plates and Tritan diagnostic plates. It also classifies Protan, Deutan and Tritan and the severity. So that's helpful for classification, which HRR doesn't do very well. Because it's symbol, because it's not a number or a letter, it can be used in a relatively younger population like children who are barely 2 or 3 years old, who can basically recognize shape. So it has multiple advantage. The other advantage is if you're performing for a left eye, you can turn around the test upside down and offer the same test to the patient so that they don't memorize the symbols or circles. So it's kind of interesting that you can flip around the test and offer the same test to the other eye without the patient memorizing. Here in the lab, you can just offer it as it is, but generally speaking, if you're suspicious if someone is memorizing these symbols or the plates, you can actually flip around and offer the test. Remember, when they have to not only call whether it's a circle or a triangle or a cross, they have to point out whether it's in the top left, top right, or bottom left or bottom right. And if there is nothing there, they have to say nothing. Don't give them more than approximately 5 seconds. Okay, if they take too much time, make a note of it, because that kind of indicates there is some kind of issue. One of the other important thing I want to tell you is the version you are using is called the HRR 4th edition. There have been 3 editions. The 4th edition is supposedly good. The ones that is sold in the market is an improved version of the 4th edition where they've made improvements. So the reason for using certain failure criteria is based on how color normals perform and how good is the test in detecting color defectives. So if you use 1 error as a failing criteria, and otherwise greater than 1 error as a failing criteria, allow 1 error or 0 error in the screening plates, the test sensitivity is about 1 and the specificity is 0.97. So what that means is it is 100% pretty good in identifying color defectives if you are using the criteria of no errors or just 1 error in the screening plate. So that's a very important finding because that is helpful. If you allow 2 or 3 errors, then the sensitivity of the test decreases. So that's one of the important things as far as the screening plates are concerned. The other important part is as far as the diagnostic plates are concerned, based on research, it's found that it correctly classified Protan and Deutan in almost 86% of occasions, so which is pretty good. About 11% it had, it didn't classify, and about 3% it misclassified. So I've had that experience where the Nagel anomaliscope said the person is a Protan, but the HRR would say it's actually a Deutan. So that's something to keep in mind, that these tests are not perfect because they are based on color confusion lines for Protans or Deutans. So it doesn't always work out. So sometimes a Protan could see both the Protan and the Deutan symbol because for that particular person the colors probably did not fall along the lines of color confusion. The other important thing to remember is those having a mild defect in the HRR test typically pass the Farnsworth D15 arrangement test. which is which again tells you that this test is actually a lot more sensitive. The other drawback of this test is not all the protanope and deutanope were classified as a strong defect. If you look at the classification of where they make mistakes, so sometimes there is an overlap between medium and strong defects as far as dichromats. Dichromats means they have only two kinds of pigments. Either they could be protanope or deutanope. Here is the example I've shown you before. The one on the top right is an example of a color normal. So you'll get everything right after the screening plates. And here on the bottom you can see a Protan defect where a Protan sees more number of Protan diagnostic plates. A Deutan one on the right has more Deutan checks on the Deutan diagnostic plates. You can see they didn't make, they didn't see any blue, red, green plates in the screening plates. That's why you did the diagnostic. And here is a situation where you have unclassified defect, typically acquires an acquired condition or a disease, ocular disease condition like diabetic retinopathy, where all types of cones are impacted. In advanced stages where there is significant retinal damage, sometimes you can get an unclassified defect. There is no particular pattern. Usually in case of congenital defect, they are typically Protan or Deutan. It has a classical defect. Here is a video of the HRR pseudo-isochromatic plate test. This is the 4th edition made by Richmond product company. This is under the standard illuminant C. So this is the initial test instructions for you. And here's the scoring plate. And on the left side is the diagnostic. The left side is the screening plate, and the right side is the diagnostic plates. Just trying to adjust this. So you can see that it starts from number 5 because the first 4 are demonstration plates. Sorry about that little shake. Here is the first demonstration plate where you can see a circle and a cross. It should be really visible to all the color defectives, whether you're red, green or blue, yellow. It's been deliberately designed that way. That's plate number 1, demonstration plate. The plate number is given behind that particular plate. Here is a cross and a triangle. They are on the up side. This is plate number 2 of the demonstration. The next one is plate 3. You just have 1. You see a circle there. This is again a demonstration plate. And 4, you don't see anything. It's a empty plate. So you can see whether somebody is pretending or malingering. If they say there is something here, it should be suspicious. So this is plate number 5. This is used for detecting blue-yellow defects. So color normals and red-green defectives should be able to see a circle and a cross. That's plate number 5. That's written behind. This is plate number 6 where you can see a circle and a triangle. This should be visible for normals and red-green defects, but not for the blue-yellow defects. That is the 6th one. This is the 7th one where you see a cross and a triangle. This should be visible for color normals and blue-yellow defectives, but not for red-green defectives. The next one is plate 8. You can see a circle and a triangle. That's plate 8. You can see. Here is plate 9. So you should be able to see a circle here if you're a color normal. That's 9. And this is plate number 10 where you should see a cross. That's plate 10. And plate 11 on the right that's coming up is the diagnostic plate. So only if you get significant error in the screening plates, that is more than one error in the screening plates, you would even proceed to number 11. Otherwise, end of the story, if they didn't make any mistakes in the screening plate, you're done with the test. So this is plate number 11. which is essentially the diagnostic plate. You can see a circle and a triangle here. You can ask the patient to use the brush to point out. That's plate number 11. And the next one, this is plate number 12. You should be able to see a cross if you're a Deutan or even a normal. So that's plate number 12. Plate number 13, you should be able to see a triangle. Plate number 14, you should be able to see a circle. There you go. That's 14. I think I missed one thing. It should be both a circle and a cross. I probably didn't see the other one properly. Now we are in plate 15, where you should see a cross and a circle. And this is plate 16. It's a triangle and a circle. Just ensuring this plate 16. Next one is plate 17. Plate 17, you should see a circle and a triangle. That's 17 written behind. 18, you should see a triangle and a cross. That is 18. The 19, you should see a cross and a circle. There you go, cross and a circle. And 20th, you should see a circle and a triangle. That's a circle and a triangle. Remember, we are not really going to offer this part for a normal individual. You can try this, but these are specifically for color defectives. Now we'll move on to plate 21. This 20 is done. 21 is a cross and a triangle, which you can easily see. And 22, you can see a cross and a circle. And see, this is 23. You can see a circle and a triangle. And 24, you can see a triangle and a cross. These are blue-yellow diagnostic plates. So that's the end of the test. Okay. So it's pretty easy. Count the diagnostic errors, total them up, see whether you have more Protan or Deutan. That decides whether Protan or Deutan are unclassified. So the screening plates decide whether you have to move to the diagnostic plates. Otherwise, it's a quick test to administer and fairly easy to do.